BPDCN, or Blastic Plasmacytoid Dendritic cell neoplasm, is a rare hematologic malignancy. It's basically an aggressive form of acute leukemia, and there are a number of new targeted therapies which lead to a good response rate, but eventually all these patients relapse. So the curative treatment for these patients is an allogeneic stem cell transplantation. And at our institution, we have a big number of these patients, thanks to my colleague, Dr. Pemaraju, who has a number of clinical trials. So over the last several years, we have looked at our data, and we found 31 patients who had received an allogeneic stem cell transplantation at MD Anderson. Now, BPDCN can present with skin involvement. It can present with bone marrow or blood involvement. There were about 13% of patients who also had CNS or cerebrospinal fluid involvement. So it's an aggressive type of disease. So of those 31 patients that we transplanted, about 3/4 of them were immediately after the induction treatment, while there were 7 patients, or about 1/4 of those, who received their transplant after they had relapsed or progressed after multiple prior treatments. So what we showed here is that, first of all, most of those were from unrelated donors, about 40%. We used a conditioning regimen or preparative regimen of busulfan plus fludarabine in more than 50% of those patients. And in terms of graft versus host disease prophylaxis, we used post-transplant cyclophosphamide in 3/4 of those. And then when we looked at their outcome, what came out significant was that at 2 years, about 60% of those patients were alive and in remission, and about 70% were basically alive. And when we looked at those patients who received transplant in their first remission versus those who received transplant after relapse, there was a significant difference. So patients who had their transplant in first remission, almost 70% of them were in remission and alive 2 years or longer, essentially showing that these patients can potentially be cured, versus patients who had prior relapses. Unfortunately, most of them didn't do well. So based on these, our conclusions are that yes, an allogeneic transplantation is a potentially curative treatment, but the best results are in patients who are early in their course of disease rather than relapse. Of course, allogeneic transplant is associated with treatment-related complications. Luckily, we didn't see very high chronic graft versus host disease, but treatment-related mortality overall was still about 20%. In recent years, this has gone down, but those are some of the issues we still have to contend with.